On September 26, 2011, the headline of the Globe and Mail reads, "Woman, 61, will give birth to first child." It would seem that an appropriate reaction to this headline is shock and disbelief. That a woman of that age would be given the approval to receive pregnancy-assisting treatment. Is it moral to allow a woman who, on average, will only live 21 more years to have a child?
We think that the Canadian government should instate a law creating an age limit for the use of pregnancy-assisting technologies.
A 66-year-old woman set to give birth next month, setting off a firestorm again of medical and ethical issues. Raising the question, how old is too old? Is there any age that's too old? Let's begin with ABC's Nick Watt.
A 66-year-old successful career woman about to become a first-time mom. Elizabeth Adonai, now 8 months pregnant, will be one of the oldest mothers in the world. Chatter on the internet ranges from wonder at the miracle to harsh criticism, calling her decision to have IVF breathtaking selfishness. When she's 85 years old, her child will still be a teenager.
Oh, hello there. I'm just lightly reading out of my medical journal, and I hear that you're talking about pregnancy-assisting technologies in older women. Assisted reproduction technologies include in vitro fertilization, IVF, which is when the sperm and egg are fertilized outside of the body and then placed inside the uterus. In vivo fertilization is when a fertile woman donates a fertilized ovum, which are found in the fallopian tubes, and is transplanted into an infertile woman. There are many other fertility treatments that include taking medication or other different kinds of therapies. The treatment we will mostly focus on is the in vitro fertilization, since it's most commonly used amongst older women.
So why are women having children later in life?
Career.
Women are choosing to pursue careers in their early adulthood, thus they are usually waiting until they finish their studies to begin a family. According to research that was conducted in December of 1999, 2001, 2003, and 2005, the level of post-secondary education participation by young adults is gradually rising. Another study was conducted by Statistics Canada that states women's participation in university has outpaced men since the late 1970s. In fact, the gap widened substantially during the 1990s. In other words, the number of women attending university is increasing, which results in the increase of women waiting to have a family.
In addition, choosing the right partner is never an easy task and can be time-consuming.
Every woman has the right to make an autonomous decision on whether or not to become pregnant.
Another counterargument for allowing older women to conceive through medically induced pregnancy is the advantages that are associated with an older, wiser parent caring for the child. Greater income can improve a child's environment by providing more options for services that can help educate and maintain good health for the child.
So what does the public have to say about older mothers?
I'm sorry for a child who's born to a woman in their 50s or 60s, because it's going to end up being a lonely child maybe and lose its mother when it's a teenager.
I wouldn't do it. 60 is way too old for a woman to go through IVF to have a child.
Just not right, is it? Because if your friends and that come round, they'll be like, oh, how old's she? And that's your mum. It's more like your nan, isn't it?
Women of advanced maternal age face many risks which younger women do not. These include risks to the cardiovascular system, along with a much greater chance of postpartum hemorrhage and cesarean section.
The health risks associated with older women would negatively affect the environment in which a child would be raised. With the potential for loss or poor health of the mother being greater, it is important to take into consideration the negative effect of losing a parent on a young child. There are many documented long-term effects of early parent death. For example, the association between early death of the mother and severe forms of depression in adulthood.
Older parents must consider their own health prior to bringing a child into this world. They may have inadequate stamina and lower energy levels than younger parents. In Britain, the Human Fertilization and Embryology Act, which administrates IVF treatment, reads, "A woman shall not be provided with treatment services unless account has been taken of the welfare of any child who may be born as a result of the treatment, including the need of that child for supportive parenting, and of any other child who may be affected by the birth." This should be implemented in Canada to ensure the safety and stability of the potential baby.
In conclusion, assisted reproduction technologies are very useful for couples who use it respectfully. Unfortunately, there are always people who push the limits, and as discussed, the Canadian government should instate a law creating an appropriate age limit for any of these technologies.
According to Eisenberg and Schechner, this limit should be 55 years of age. This seems like an appropriate cutoff point for women who wish to conceive a child. The purpose of instating an age restriction is not to take away rights or to generalize all older women by predicting that only bad things can come out of having a child at their age, but rather for the protection and well-being of the child.
Not only is it very risky for the mother, but more importantly, it has very serious consequences on the child.